Hello there. Welcome to the program My Health, My Responsibility on CRBC TV Calabar. I am Abasiono Eshet, your host. Today we are discussing something very powerful and something natural, that is exclusive breastfeeding. The World Health Organization has advised that every child must be exclusively breastfed till 6 months and more. So right now, we want to know, what is exclusive breastfeeding? Why is it so important? And on that note, we have a very important guest here with me to give us insight on that topic, and that is Madam Margaret Anashe from the Office of Cross River State Primary Health Care Development. She will help us break that down. Thank you very much, ma'am, for joining.
I am glad to be here. From my understanding and World WHO standard, exclusive breastfeeding is a method of breastfeeding that is being conducted within 1 hour of birth. The mother breastfeeds her infant until 6 months without food, without water, with only breast milk. Then within the period of 6 months, when only breast milk can no longer contain the baby's needs, we can introduce what we call complementary feeding, and the mother continue breastfeeding until 2 years and beyond. Then we come back to early initiation that I earlier mentioned. Early initiation simply means putting the baby to breast within 1 hour of birth. Given this, it comes with benefits.
So it's safe to say that exclusive breastfeeding is just giving a child breast milk, nothing else.
Only breast milk,
Okay.
without water, without food, for the period of 6 months.
Okay, why is that?
Because it has so many benefits. Let me start from early initiation to breastfeeding. Within this period, within 1 hour of birth, it is a golden period where the baby's sucking reflex is very active and alert. With this sucking reflex, it can stimulate the mother's brain to release the hormone called oxytocin that causes the contraction of the uterus, brings about expulsion of the placenta, and reduces blood loss, or we have minimal blood loss to avoid what we call postpartum hemorrhage.
Okay.
Then another benefit with this colostrum is within this period of early initiation, there is a breast milk that is being produced. It gives the baby the opportunity of taking this breast milk called colostrum. And this colostrum is the first antibiotics, the first immunity that the baby gets. That is the first immunization the baby gets. It has other effects. It creates what we call bonding between the mother and the child, because in a normal process whereby a baby is early initiated to breastfeeding, you see the baby is delivered over the maternal abdomen. That is skin to skin initiation. It causes bonding. There is communication at this point. It gives the mother even relaxation. There are so many other benefits that follows this. It helps the baby's brain to be developed. It is the only food that the small intestine of the baby can digest within this period. So the benefit is of the mother, of the baby, of the society at large, family and the society at large. Then to the baby, I have mentioned several ones, like the first immunity, causes bonding, and the rest of others. Then to the mother, let me be specific. That is when expulsion of placenta comes in. It gives the mother what we call minimal bleeding to prevent PPH. So there are many other benefits that comes with this. To the family,
Saying the benefit is not just for the child.
not just for the child, but also for the mother, the child, and the family.
Please, we'd like you to throw more light on the benefits for the mother.
For the mother,
Yes.
I have mentioned bonding. Causes relaxation to the woman. It early expulsion of placenta. It causes less bleeding. But that is when the uterus is being contracted. You see, it reduces the bleeding.
Okay. So we've heard that that breastfeeding or breast milk is considered as the most nutritious food for a child.
Yeah.
So, what nutrient does it contain that other baby formulas doesn't have?
Breast milk, it contains all classes of food, in short.
Okay.
It contains protein, it contains carbohydrate. It even go ahead, as in it went as far as containing the micronutrients that are not found in several foods that we eat, like iron, calcium, iodine. All those micronutrients are contained in the breast milk. Then some mothers will tell you that it does not contain water, that the baby cries too much because of starvation and the rest of other things, not being satisfied with the breast milk because it does not contain water and it does not contain what can satisfy the baby. Breast milk contains water, from 70 to 90% of water. It has all the constituency in the right proportion. It can be given in the right proportion. It is safe and readily available at any time.
Okay. So to the mothers that keep saying that the breast milk is not enough, maybe they should add water or they should add something else. How are they supposed to know? What are the signs to know that okay, that this breast milk is enough for my baby, that this alone satisfies my baby?
Okay, let me start by this illustrating or giving you the stages or how the breast milk is being made. Breast milk as it is in two phases: the hind milk and the fore milk. The fore milk is just like, I normally use this illustration. When you are preparing akamu, you keep it for preservation. It is being mixed with water from the beginning. At the time you keep it to settle, by the time you go there to either scope to use, you see that it is in two phases. The water is up and the content itself is down. That is how breast milk is. So what you do is you advise the mother to breastfeed patiently. That is why we need the support of grandma. We need the support from the family so that the mother will be able to pay attention to breastfeeding. You breastfeed one breast, empty one breast completely before you move to the other one. If baby shows a sign of satisfaction, that is to say it is in a correct proportion and the baby is satisfied, that is when you stop breastfeeding.
Okay, so is it when you empty
one breast completely?
The child is satisfied.
If the baby is not satisfied, the baby will still show you a sign, you move to the next breast.
Okay, no problem. So, but there are some popular myths about breastfeeding that say that breast milk is not enough, or maybe during dry season they'll be like, please just give the child water. The weather is too hot, the child needs water too. So what would you advise in that situation? Is it advisable to give the child water in that, maybe let's say hot weather? Is it advisable?
No, it is not advisable. What we normally advise mothers to do is, if you are breastfeeding, to have a successful breastfeeding, in addition to your normal meal, there should be 2 extra meals that can give you strength to go along with it. When you take enough intake of fluid yourself as a mother, you eat enough food, you will have the strength. The breast milk is natural phenomenon. It contains everything, whether in hot weather, whether in cold weather, it is what God has made.
Okay.
So there is no need of giving water during hot weather or whatsoever.
Okay, we've spoken about support, and they need mothers, they need family members to support the breastfeeding mother. In that case, how are they supposed to support the breastfeeding mother, because they cannot help give the child breast milk?
No.
So what would you advise?
The support comes in. That is why enable land is a very important period.
Okay.
You see the grandmas coming for Mugo to support with other activities, other house chores, so that the mother will pay full attention to the baby.
Okay.
The father can assist by encouraging the woman to breastfeed, not kicking against breastfeeding whatsoever. Like in some cases, some men, like we went for market sensitization yesterday, one man came on and said the breast milk belongs to him, it does not belong to the baby. So in that aspect, you need to counsel the father. In short, the fathers should support, and they should bear it in mind that breast milk at this period is for the baby, not for him at this point in time. Even though he will meet the wife, he should come from behind while the baby is in front. Then grandmas, in their own cases, some of them have that notion that the baby is being starved. You understand? So with that knowledge of old, they will bring water to the newborn baby or the mother, trying to encourage her to give the baby water. So the grandmas, they are not supposed to bring water to the mothers. They should be made to understand that breast milk contains water. Because in some situations, they will tell you, I gave your husband water. How comes he grew very strong and intelligent and you admired him? So this child also should not grow without water. So in that case, they are being encouraged not to, because only breast milk can stand a chance of making the baby to develop well, to develop intelligent, create immunity, make them to visit hospital minimally than the baby that is not exclusively breastfed.
How do you convince, let's say, an old school mom, or let's say the grandma or the father, that you not giving the child food is helping the child, grow better and not visiting the hospital? Because I was having this conversation with someone yesterday, and they're like, no, my wife cannot do that, because in my own time, my mother gave me food, she gave me pap, she gave me everything. How do you convince such an old school or someone that is not so enlightened about something like this?
Educating them.
Okay.
Create awareness. Like we create what we call community support group.
Okay.
The grandmothers are involved, the grandfathers are involved, the fathers are equally involved. From here, when they are well informed, they will be able to implement what is obtainable.
Okay. So what's your advice to mothers that are, let's say, people that are doing 9 to 5? You mentioned something about taking your time to give the child breast milk, let's say, for a certain number of time. So for someone that is doing 9 to 5 and doesn't have that kind of time, how would you advise the person to go on with exclusive breastfeeding?
As in career mothers.
Exactly.
No matter where you work, there should be something like crèche where you can be excused once in a while to breastfeed your baby. Or you can do what we call breast milk extraction. You extract your breast milk into a cup, you leave it at home in a fridge for a minimal period of time while either the grandmother, whosoever is taking care of your baby, can be breastfeeding.
Okay.
It's cup and spoon is what we encourage, not with feeder.
Okay. No feeder.
No feeder.
Cup and spoon.
Cup and spoon.
Okay. That's all right. So if you have just joined us, this is My Health, My Responsibility with Mother Margaret and Nashe, and we are discussing exclusive breastfeeding. Please stay with us. We'll be right back after the short break. Thank you for staying with us on the program. Before the break, we discussed exclusive breastfeeding, the uses and its benefits. Right now, we move forward to how long, what's the duration for a working class mother if she keeps her breast milk? How long would it last, and how long can she keep it that will still be okay for the baby to take?
The storage, it should be stored in the room temperature of 25 degrees centigrade or below. Then how long it lasts? It lasts for 4 hours. It is best if used within 4 hours in very hot places, like maybe in hot temperature or wherever the temperature is above this 25 centigrade, it can be used within 1 to 2 hours.
Okay, thank you very much. Please, we would like you to speak about mothers who experience pain or sore nipples. I also hear of people that have low milk supply. How would you advise them to go on with exclusive breastfeeding?
Breast pain can come as a result of improper attachment and positioning. When the woman is not properly positioned or do not properly position herself before breastfeeding, it can bring about back pain, can bring about cracked nipple. So in order to avoid this, during health education, during ANC, or when the woman puts to bed, when you carry out early initiation, the woman needs to know how to position herself by sitting in a relaxed manner. If it is a woman with short status, maybe you can raise the woman's leg to a point where the baby can be properly positioned, and attachment, you make sure the baby's mouth is widely open. You see, the nipple should be pointed directly in the baby's mouth. Then the baby grabs part of what we call the areola, the black pigmented area of the breast. Then it can avoid the cracked nipples. Once the nipple is right inside the baby's mouth, you see that breastfeeding will be successful. And at this point, you will hear the baby boom, 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 boom. But in a situation where the baby is poorly attached, you hear in that case, you will see that at the end of the day, you end up with what? Cracked nipple. Then if the woman is not properly relaxed, it comes up with back pain.
So how about mothers who suffer from low milk supply?
Low milk supply.
Would you advise they give water or food during the first?
No.
Should the baby starve?
No, the baby doesn't starve.
Okay.
It is due to this poor attachment, number one, poor positioning, number two, and the sucking reflex can bring about milk production. Maybe the baby was not properly attached. Because of that, it can hinder the breast milk production. So the mother will be taught on how to properly attach the baby, on how to position, and the frequency on breastfeeding.
Okay. You mentioned earlier that exclusive breastfeeding helps reduce child sickness.
Yeah.
So to some people that believe no, that this is not true, that I think food is even better to give the child strength. How would you please throw more light on that? How does exclusive breastfeeding reduces the child's sickness?
It reduces because it contains antibiotics. I have earlier mentioned colostrum, that colostrum contains the first immunization that baby receives, contains antibiotics. So with this, it builds the baby's immune system, thereby preventing the baby from getting what we call diarrhea, pneumonia, and reduces the frequency of hospital visits.
Okay. So in your experience, or how long you've been in this field, how long is it? I mean, we know about exclusive breastfeeding that's supposed to be for 6 months before you give water or any other supplement. How about the normal breastfeeding? How long are you supposed to breastfeed a child? Let's go a little away from breastfeeding.
A child is supposed to be breastfed within 30 to 1 hour.
No, like the age is 1 year you stop out, because some
Okay.
people
While I was explaining what exclusive breastfeeding is, I mentioned it that after 6 months, when complementary feeding has been introduced, the baby should be breastfed alongside the complementary feeding for 2 years and beyond.
Wow. Okay, so 2 years and beyond.
Yeah.
Would I ask any special benefit? Because I know a lot of people that will be like, once the child just starts eating any solid food, they'll be like, please, it's okay. That's why I stop for now. Any special benefit or any risks if they stop breastfeeding a child, let's say anything lower than 2 years?
The content of the breast milk has not reduced at this point, so it still continues.
Okay.
So in addition to the complementary feeding, it complements it.
All right. In your experience, please kindly tell us what are the barriers that are stopping Nigerian mothers, especially the ones in Cross River, from practicing exclusive breastfeeding?
The barriers that hinders breastfeeding can be health-wise,
Okay.
maybe health complication due to cesarean section. It can be loss of mother, can hinder it. Poor knowledge can hinder it. Cultural beliefs.
So in that case, there is nobody to give the child breast milk, especially the first breast milk.
Yes, ma'am.
What kind of formulas would be advised to be given to that child at that point in time? So they are not bad.
It's not as if they are bad,
Okay.
but what is advisable, and from my explanation from the beginning, I said the small intestine can only digest breast milk.
Okay.
But when there is any issue, we can bring it in just to keep the baby. It's not as if it's a priority.
Okay. So it's just to keep the baby.
Just to keep the baby.
All right. Thank you very much. So we'd just like you to give like a final speech to somebody that is still not convinced that exclusive breastfeeding is the best way. What do you have to say to that person?
Though they said knowledge is power, is a popular say. When once you are well informed, you act well. So, mothers out there who don't believe that exclusive breastfeeding is very important, I stand to tell them, my children were exclusively breastfed. I cannot not remember when we visited hospital, right from when they were given birth to. Very active. Even in school, they perform well. So, with all this, I believe breast milk is the best for the children. Because some of our mothers, elderly mothers, they will tell you that in those days, they used to breastfeed their children only breast milk until when the baby starts having that quest for food. So maybe if you check critically, you can see that it is when the baby has grown to be able to identify something that the baby will be able to quest for food. With that, some children were ignorantly, exclusively breastfed without knowing to them. So I stand today to tell the world that exclusive breastfeeding is very safe, is very effective. It can move with you to anywhere. You don't need to prepare anything before you give to the baby. Whenever the baby needs it, you can be readily available at any time. You do anything with your breast at any time you give to the child. So you don't need to go ahead looking for one or two things that maybe may cause the baby unhygienic environment and whatsoever. It is readily available for the children, and it makes the children grow very healthy and strong.
Thank you so much. I must say thank you to the wonderful Madam Margaret Anashe. Thank you so much for joining us.
Thank you.
Madam Margaret Anashe from the Office of Cross River State Primary Health Care Development here in Cross River State. Thank you very much for your time.
Thank you, Ma.
Okay, we know that exclusive breastfeeding for 6 months gives the baby the healthiest start in life. So take notes and do that. I am Abastiano Eshente.